Hi, my name is Peter Law, and today I will be talking about the forecast and prediction of CVS Health Corporation. CVS Health was cited and fined by state regulators in Oklahoma for conditions found at Forbes Pharmacy, including inadequate staffing and errors made by filling prescriptions. In addition, the state auditor found safety issues, long wait lines, and wrong information on prescription refills. The state board inspected CVS Pharmacy from 2019 to early 2020. Because of the inability to meet consumer demand and loss of patient trust, CVS started to lose market share to its competition like Walgreens, causing decline in sales at new CVS locations. Now, this problem is not addressed, the potential failure of CVS could be catastrophic. Using the prescription refill data from CVS in the previous 10 years, time series forecasting technique can be examined, patterns to predict the outcome for future time period. Based on the sales data, the forecasted value of prescription refill up to 2025 would still be lower than the figure in 2018. CVS must make changes to monitor patient safety, improve the quality of its pharmacy services, and listen to feedback from the pharmacists and the pharmacy staff of the company. In letters to state pharmacy board and in interviews, pharmacists working for CVS allegedly admitted that they struggled to keep up with the increased number of tasks, including filling prescriptions, giving flu shots, tending drive-through windows, answering phone, and calling patients. These are potential risks that could negatively affect the organization operations. The risk diagram below could help CVS tackle potential problem and measure appropriate action. If you look at the risk diagram, you can see that there are a different type of risk. For example, increased government regulation due to citation has a low risk likelihood and a low risk consequence. However, lawsuit over refill practices has high risk likelihood and high risk consequence. Organizations around the world have invested in millions in improving quality. In some cases, corporate cultures have been changed through the implementation of a new quality philosophy called total quality management. Total quality management involves all members of the organization in improving quality. In addition, the goal and objective of the organization come under the purview of quality control and can be measured in quality terms. In the statement, CVS said that the patient safety is the company's highest priority, and the leadership team is committed to improving its safety record by using technology and training to enhance accuracy. Using Deming's 14-point plan, CVS would carefully analyze all decisions about staffing, labor hours, workflow process, technology enhancement, and other operational factors that may to ensure that CVS pharmacy location would have appropriate level of staffing and resources in place at each pharmacy for the safe and accurate filling of prescription. Six Sigma is a quality movement, a methodology, and a measurement. As a quality movement, Six Sigma is used to evaluate the capability of a process to perform defect-free, where a defect is defined as anything that results in customer dissatisfaction. Six Sigma is custom-focused and has the potential to achieve exponential quality improvement through the reduction of variation in system processes. Six Sigma can help CVS reduce process variations and increase process capability. The benefit delivered by this process include reduced processing times on prescription refills, accelerated digital delivery of information, consistent effort to eliminate waste, and increased probabilities of meeting customer requirements. The adoption of Six Sigma resulted in a culture of which thinking is embedded at every level in every operation throughout the company. CVS could consider the use of process analysis to assist managers and workers in identifying, categorizing, and solving problems in the continuous quality improvement process. The following flowchart is used to identify choke points in completing a prescription refill. CVS Health is one of the leading drugstore chains in the United States, with a store located in over 40 states. CVS is a pharmacy innovation company that includes pharmacy benefit management services, retail and specialty pharmacy, retail clinics, and health offering programs. With over 80 million customers passing through their pharmacy every day, CVS is always striving to provide more meaningful interaction that put customer on a path to better health. CVS will focus its expansion effort on remodeling store into health hubs by the end of 2021. Health hubs will be more staff intensive to offer customer a more personalized experience and medical advice specific to their need. As the company broadens its vision to reshape healthcare over the next decade, CVS will use its leverage with Aetna, which it bought in late 2018, to drive its efforts. By 2016, the aging populations will make up 23% of the population. Their care is often more complex, so new protocols and tools will help them keep healthy longer. Understanding this challenge, CVS is improving its ability to deliver affordable, accessible, and effective care to the populations by adopting a digital marketing strategy for advertising. Because CVS is an innovative company that relies heavily on technology, it requires infrastructure in place to support CVS digital operations. The organization must seek technical viability and service coverage in new locations to improve the integration of established networks. The company also needed to build relationships with local retailers and supermarket chains before entering a new market. In recent years, CVS began to focus on strengthening the workforce to satisfy the health needs of customers in retail, pharmacy, and health services. The company also improved on employee retention in personal and professional development, which is essential in making the organization competitive. The company is projected to be responsible for 46.55% of all retail prescription filled in the United States by 2025.